Good morning. Start of another work week, or not. Everybody knows from my right, Dr. Jim Malatras, not a medical doctor, still a doctor. Medical doctor, Dr. Howard Zucker. To my left, Melissa DeRosa, Secretary to the Governor. To her left, Robert Mejica, Budget Director Extraordinaire. On the numbers, the number continues to increase. We're up to 8,658 new cases. Overall, we have 130,000 people who tested positive, 16,000 people in our hospital system, 13,000 people have been discharged. Number of deaths are up once again. Number of people we lost, number of New Yorkers, 4,758. Which is up from 159, but which is effectively flat for 2 days. While none of this is good news, the possible flattening of the curve is better than the increases that we have seen. New York is still far and away the most impacted state. New Jersey is having real difficulty, and been speaking with Governor Murphy from New Jersey, and anything we can do together, we will. Michigan also. California has leveled off, and Louisiana is having a difficult time, so they're in our thoughts and prayers. Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs, and again, would suggest a possible flattening of the curve. The number of discharged is down, but that reflects the overall reduction in the numbers. Big question that we're looking at now is what is the curve? And we've been talking about cases increase until they don't. When they stop increasing, then what happens? And the projection models have a number of alternatives. Some suggest basically the curve goes up and then drops precipitously. Some suggest there's a slight pause at the top. Some suggest there's a longer pause at the top, which is effectively a plateau effect. Or again, the straight up and straight down precipitous drop, which is the peak effect. No one can tell you which will occur. They say any one of the three options. You study other countries, you've had a combination of the above. We are studying it as we have used the projection models from day one to determine actually what we do. How do we set policy and program? By following the data. Dr. Malatras has been working on the numbers, working with the statisticians and the projection models, and helping us incorporate that into an operational model. And Jim, if you want to just take a moment and speak about the projection models here, please.
Great, thank you, Governor. As the Governor said, we have been looking at projection models from the beginning to determine the size and scope and severity, and the Governor has mentioned this over his briefings. We've been working with many organizations and using the data like Imperial College, the Institute for Health Metrics and Evaluation, Cornell, McKinsey, and others. And some of the initial projections that we first saw at the beginning of this was at least 100, up to 110,000 beds for COVID patients alone. And the peak would come at the end of April. Those were some of the earliest modeling from many organizations that it would be at the end of April, around 110,000 beds just for COVID patients. There are other models, too, that we were tracking, one being lower at about 55,000 COVID beds, but again, peaking at the end of April. We follow now that we have a pretty robust data set to go by for the last several weeks. The bottom line there, the purple line, is sort of where we are tracking today, which suggests it's a little lower. And the question was, what could you do to lower those initial projections from 110,000 and from 55,000. So a lot of the activity was, we saw where the statisticians and the folks looking at these types of models said it was going. So what activities and actions could you take to aggressively lower that overall number? And the answer really was, and what the governor has been doing, was aggressively enforce and enact social distancing to lower the overall number. And this number and the current data suggest that that is exactly what's happening. And it's not settled yet because we are going day by day, and the numbers, as the governor says, has changed a lot over the time based on what numbers come in. But this could suggest that we are indeed potentially at the apex, or beginning to be at the apex at this moment. Like the governor has said, there's been a range of models, 7 days, 14 days, 21 days, 30 days. It looks like we're towards the earlier side of that time frame based on the current projections and modeling that we've been looking at.
Thank you, Jim. But you also see on these, you see on this slide where we are now, right? And it can still go any way. We could still see an increase. So it is hopeful, but it's also inconclusive. And it still depends on what we do, right? These models all have a coefficient of what we do and how successful we are at social distancing, et cetera. And from our decision-making point of view, it doesn't really matter if we've hit the plateau or not, because you have to do the same thing. If we are plateauing at a very high level, and there's tremendous stress on the healthcare system. And to say to this healthcare system, which is at maximum capacity today, right? This is a hospital system where we have our foot to the floor, and the engine is at red line, and you can't go any faster. And by the way, you can't stay at red line for any period of time because the system will blow. And that's where we are. We are at red line. People can't work any harder. The staff can't work any harder. And staying at this level is problematic. And if we are plateauing, it's because social distancing is working. So we have to make sure the social distancing actually continues. On the relieving the pressure on the hospital system, which is unsustainable at this rate, we're continuing what we call our Surge and Flex program, where we get all the hospitals on the line on a daily basis. They're all doing inventories, they're all doing data sheets, they're all on the telephone, and we're shifting among the hospitals, ventilators, PPE equipment, who has gowns, who has masks, and that happens on a daily basis, that adjustment. Also, to relieve pressure on the hospital system, the Javits coming online is a very big deal. That is the relief valve for the entire downstate system. The 1,100 military personnel started to come in. 300 were sent to New York City public hospitals to help the New York City public hospital system, the H&H system, which has been under stress. The rest will be going to Javits to bring that up and running to full capacity. That transition is happening now. That is a COVID center now, started as non-COVID. It's now a COVID center. The majority of the military personnel will be coming in tomorrow and the next day. But that Javits Center is going to be a major relief valve. Second, the United States Navy ship Comfort. The original plan was that would come in for non-COVID people. The original plan was it would also be a relief valve on the hospitals, but not for COVID people, that it would take all the non-COVID patients, if you will, from the hospital system. That was the plan. As it turned out, there's not a lot of non-COVID people in the hospital system, which is a separate story, happens to be a good news story. A byproduct of shutting everything down is you have fewer car accidents, crime rate is way down, fewer trauma cases, so there is not a large non-COVID population in the hospitals. I'm going to call the president this afternoon and ask him to shift the comfort from non-COVID to COVID. Then we would have Javits and the ship Comfort as a relief valve. That's 2,500 beds and 1,000 beds. That's 3,500 beds, which could serve as a relief valve for the whole downstate hospital system. That is the only way we sustain this level of intensity in the hospital system. And I understand what the original plan was with the Comfort, but I understand that there is no preordained strategy here. You have to feel it out day to day, and you have to adjust with the facts. And we don't need the Comfort for non-COVID cases. We need it for COVID. If we had those two facilities as a relief valve, that would make a significant difference. Now, bringing online 3,500 beds is no small task. Northwell Health is going to help us manage those, but they're going to be staffed by military personnel. Only the military could bring in that many people that quickly with that logistical operation. And I want to thank DOD very much for their cooperation because God bless the U.S. military. We're fully aware of what they do to defend this nation, but this is a different application that we don't see every day, and they're doing an extraordinary job. So I'll call the president. He has been helpful to New York in the past, and he's moved very quickly in the past. I'm going to ask him if he can make this adjustment for us because it would be truly beneficial. We would feel much better knowing that we can sustain this pace if we could start to offload patients to these two facilities. In any event, plateau, not plateau, we still have to extend New York pause because if that curve is turning, it's turning because the rate of infection is going down. One of the reasons the rate of infection is going down is because social distancing is working. We have to continue the social distancing. Schools and non-essential businesses will stay closed until April 29th. I know that's a negative for many, many reasons. I know what it does to the economy. But as I said from day one, I'm not going to choose between public health and economic activity, because in either event, public health still demands that we stay on pause with businesses closed and schools closed. Whether we've hit the apex or whether we haven't hit the apex, you'd have to do the same thing. There's also a real danger in getting overconfident too quickly. This is an enemy that we have underestimated from day one, and we have paid the price dearly. Well, the numbers look like they may be turning. Yay, it's over. No, it's not. And other places have made that mistake. Hong Kong has made that mistake. South Korea has made that mistake. And we're not going to make that mistake. The weather is turning. People have been locked up. We've been talking about cabin fever. Now it's a nice day. I'm going to get out. I'm going to go take a walk. Now is not the time to do that. And frankly, there has been a laxness on social distancing, especially over this past weekend, that is just wholly unacceptable. Look, people are dying. People in the healthcare system are exposing themselves every day to tremendous risk walking into those emergency rooms. And then they have to go home to their family and wonder if they caught the virus and they're bringing it home to their family. If I can't convince you to show discipline for yourself, then show discipline for other people. If you get infected, you infect someone else, you go to an emergency room, you put a burden on all sorts of other people who you don't know and who, frankly, you don't have the right to burden with your irresponsibility. And people, especially in New York City, The level of activity is up. Partially the weather made it a nice day. I understand people have been locked up for a long time, but now is not the time to be lax. And it is a mistake. We all have a responsibility. We all have a role in this. We said that from day one. And we have to respect the role that we play. Because the role that we play is a societal obligation. That's how I see it. I want local governments to enforce the social distancing rules. The local governments are charged with enforcement. I want them to enforce them. And I want to be, frankly, more aggressive on the enforcement, because all the anecdotal evidence is people are violating it at a higher rate than before. So we're going to increase the potential maximum fine from $500 to $1,000. But it's not really about the fine. Nobody wants the money. We want the compliance. We are serious. And again, if it's not about your life, you don't have the right to risk someone else's life. And you don't have the right, frankly, to take a healthcare staff and people who are literally putting their lives on the line and be cavalier or reckless with them. You just don't have the right. And we want to thank all of the people who are getting us through this every day under very tough circumstances. And we see the illness rate among these essential workers, and we know the sacrifice they're making, and we should respect it. It's that simple. You have the first responders who are out there, your police officers who are out there, the transit workers who have to drive a bus and the train every day, the healthcare workers who are just doing extraordinary work. So let's respect them and let's help them. We're also going to set up a fund run by the Department of Health to assist the healthcare workers with expenses, costs, child care, et cetera. I want to thank Blackstone for making the first contribution to that fund of $10 million to assist the first responders. I hope other individuals and corporations follow their lead. We're also very aware of the mental health aspect of this situation and the stress and the isolation that this has caused. And people are trying in their own way to grapple with what this means and what is the impact. How do you rationalize this situation? And the mental health aspect of it is very real. Headspace is going to partner with New York. They're an app. They're going to have content for New York and free membership for New York, so we thank them. But we also have an emotional support hotline. We have thousands of mental health professionals who have signed up to volunteer to provide mental health services, so we want people to make sure they know about that and it's available. I talk about perspective a lot, maybe frankly because partially I'm speaking to myself, and I had a good conversation with my daughters last night, Cara and Michaela, who are often wiser than I am and wiser than their years. It's very hard to see the number of deaths we're having. It's frightening, it's disturbing, that amount of loss. I'm the governor of New York. I see my job as preventing that kind of disturbance and negativity and loss for the people of the state. Perspective, we like to think that we can control everything. We can't. We like to think that we can fix everything and fix all the problems for people. We can't. The undeniable truth here is that this virus is a deadly enemy, and we will lose, and we are losing people who are vulnerable to the virus. That can't be controlled. That can't be fixed. Why? That's Mother Nature. That's a question that God can only answer. But control what you can. do what you can. The challenge is to make sure that we don't lose anyone who could have been saved if our healthcare system was operating fully. Don't lose anyone who you could save. That is a legitimate, ambitious goal of government. And that we have done so far. That we have done so far. Have we saved everyone? No. But have we lost anyone because we didn't have a bed, or we didn't have a ventilator, or we didn't have healthcare staff? No. The people we lost are the people we couldn't save. Not for lack of trying, and not for lack of doing everything that we could do as a society, not only as a government and as a healthcare system. So to the extent we can find peace in that, it helps me. And we are still New York tough, and New York tough means tough, but tough in a New York sense also means compassionate. It means that we are unified. It means that we are loving, because if you're really tough, the really tough guys, they're tough enough to show love, and because we're smart. And that's how we're going to get through this.